guys, Dr. Adams here, chiropractic physician at Miami Spine and Performance. Today we're going to go through 3 things you can do for your cervical spine or your neck, just to improve your range of motion of your neck, prevent things like headaches, stiffness, tightness. A lot of us are working at our computer right now, maybe don't have the best posture in the world. So there's a couple simple things you can do to help prevent that uncomfortable tightness, stiffness, knots, and that sort of stuff. The first one I'm going to talk about is just simply doing a cervical retraction. This is a motion that when I have people in the clinic, oftentimes they have a hard time doing it, and it's because most of the time we have our chin forward like this. So to do the cervical retraction, all we're going to do is we're going to tuck our chin straight back. Additionally, what you can do is you can take one finger, give yourself additional pressure. So we're essentially making a double chin, but we're not tucking the chin down. We're just moving the head straight back like it's on a shelf, or like I like to tell my patients, pretend someone ugly is coming to kiss you. You go straight back like that. The second movement that we're going to go through is the cervical controlled articular rotation. We've done other videos with this exercise, but it's one that I just think is excellent for getting a full range of motion of the cervical spine, especially if you have a hard time turning your head or lateral bending your head that way. It's a great way to just open things up, a great thing to do in the morning and the evening. The cervical controlled articular rotation, we're going to sit up straight, chin's going to come all the way down, rotate our head all the way to the left, drop our ear to our shoulder, roll all the way through nice and slow, chin to shoulder, drop the ear, roll down, and then we'll go in the opposite direction. So it's essentially going to be a long, slow neck circle where you try to draw the biggest circle that you can, get a full range of motion. What most people forget to do is the rotation component. Remember, cervical rotation is extremely important, especially if you get headaches up top. Getting that good rotation of that upper cervical spine is very important. So we want to make sure we're integrating rotation with our cervical cars. The third thing that we're going to talk about is going to be a little bit of soft tissue work. At our clinic, we do a lot of soft tissue therapy, active release technique, cupping, dry needling, functional range release, things like that. But there are things that you can do at home, particularly to get through the area in the upper trap, and particularly the levator scapula is one of the muscles that people often neglect. So we're going to come over here to the wall. You're going to grab any type of ball. Lacrosse ball might be the most optimal, but of course you can do this with a tennis ball. The area that we're shooting for is just inside this upper corner of the shoulder blade. And you can fish around a little bit. It's going to be tight in different areas for everybody, but we really want to get in on that levator. And what you're going to do is you're going to put the ball behind your back, just like this. You're going to let it roll down until you find that spot there. I'm going to cross my arms like this, give myself a hug to open up those shoulder blades, find that nasty spot. And then what I'm going to do is I'm going to turn my head away, drop the ear. Down, turn, drop the ear. Whenever you're doing soft tissue work, you don't want to just kind of roll and grind. You always want to integrate cervical motions. Additionally, you can do your controlled articular rotation from here while keeping pressure on that spot. You can also bring the arm into it, right? So I look down and away, I move the arm, because the muscle we're trying to get attaches to the shoulder blade, so we'll peel the shoulder blade off, look down, and we're able to sort of mimic an active release technique protocol that we do here in the clinic. Okay, so that's a soft tissue strategy for you. Again, just to review, we have the seated cervical retraction, and we can also do that with a little bit of overpressure. That's sort of to stretch the muscles out in the back of your neck, activate these deep neck flexors, and just get some good gapping back here to prevent this compression that we get from bad posture. Cervical controlled articular rotations, again, just maximizing that full cervical range of motion. We're getting flexion, extension, rotation to both sides, and lateral bending, finding those sticky spots. And then number 3 is soft tissue work with the lacrosse ball. Feel free to go up and down your upper back, get into the shoulder blade a little bit. But remember, whenever you're doing this kind of stuff, you want to integrate some type of movement. So we're looking at integrating either neck, shoulder, shoulder blade, or upper back movement with our soft tissue therapy. Thanks, guys. We'll see you next time.